Marcus Welby, the AMA used to sprinkle the medicine on, so I wonder if they sprinkled the sedative part on that, as you saw, because they were the consultants, as opposed to now on every medical series. When I did ER and on Grey's Anatomy, House, they all have doctors on the shows. And ER was the first, but then now they're all doctor writers on the shows to try to lend some verisimilitude to the process. So I know what I said. Try. In seeing those clips, I'll turn to Dr. Foley. The theme was communicating news, often bad news. And how do you see this as a part of end of life? And what can we take away from these clips, and what can we look to help us deal with that problem, if it is a problem?
It's a big problem, and I think as you saw those clips and laughed at the different scenes, these are real conversations, and they're real conversations that sadly we think even go on today. But in this project on death in America that I directed for a period of 9 years, we looked at what were the barriers to having these kinds of conversations, to improving communication. And what became so readily apparent is that, and the Institute of Medicine report that Harvey alluded to, Approaching Death, said we found the enemy and it's us. And it was this lack of communication skills on the part of healthcare professionals, mainly doctors, who didn't know how to have these painful conversations, had never been taught how to have them, and needed to be taught. And so the positive aspects, if you look at the two Marcus Welby pieces particularly, you see modeling this wonderful, trusted, caring physician who comes into the room and in the second one does the right thing. He pulls up a chair, he sets up the scene that's appropriate, it's quiet, it's alone, it's not a busy hallway. And he then gives a warning shot. He says it might be leukemia. And then he just gives all this cognitive data and has no ability to emotionally respond to the mother and to the father. And so they've shut down. They're not hearing any part of this conversation. And he's getting more angry because he's wanting to give them this information. And then his answer is to give her a sedative and put the conversation off. And it's a wonderful, I think, example of how not to have this conversation and how we're now teaching around the country in medical schools, at residency levels, in my own institution at an attending level, teaching how to be present to that extraordinarily difficult conversation where you have to convey this serious, often very bad news to a patient, to a family, and to be able to sit there and tolerate this emotional distress of the family and to be with them and to walk them through them. And so this is the way that it's sort of viewed as balancing telling the truth at the same time that you're trying to maintain hope and empathy. And teaching this is a skill. So we know we can't teach empathy, but we can teach empathetic behaviors. And so there would be 10 steps that he might take, and there are mnemonics that we are teaching doctors to use. But more importantly, we're asking them to practice it. So we videotape them in these conversations with actors. And we videotape how they respond. And we help them learn this because it's so critically important to how we can address this bigger issue of end-of-life care. Because we, healthcare professionals, are not walking, want to walk the last mile with the patient, but they don't know how to communicate about it, and they've not been taught to do it.
So in 1969, as you're just saying...
I was never taught. I graduated from medical school in 1969. It was not even an idea that you'd have a conversation. You'd just walk out the door.
So this was, in a way, a very accurate reflection. The writers were writing about what they knew,
right.
And what you knew is a fairly paternalistic relationship. The doctor told you the bad news, and then you did what the doctor told you.
Right.
And now we see the Grey's Anatomy. So what about the Grey's Anatomies in terms of your thoughts on? Are they different? Is it changed?
The most profound difference I see is the fact that in Marcus Welby, it's a one-man show.
Right.
It's a male talking to female patient in both cases.
Right.
And Grey's Anatomy,
it's a
female doctor talking to male patients in both. So there's an enormous social change that's taken place between those two shows, and even the
And
ensemble.
it's a female doctor that does heart surgery.
Exactly. But is the communication situation much better? The first clip where she says, "Yes, you're dying," that is a very truthful moment. There's an enormous power in that. Before this event, we were talking in the other room, and we were discussing, though, how the music that they added to the scene made it as if they didn't trust us to understand what an enormously powerful moment that was when that doctor looked the patient in the eye and said, "Yes, you're dying, but we'll be here with you. We won't let you go into this dark night alone." We even experimented and played it for ourselves once without any sound to see how powerful it would be without that.
It is. It's really fascinating because, in some ways, we felt in discussing it that the music told us how to feel, and yet we felt maybe a little bit less because we were told. And is that because I don't work on that show, but is there like a fear? I think that you were maybe alluding to something pretty interesting. Is this is pretty scary stuff, and if it was raw, I mean, really raw, without the nice mellow male voice singing about death and kind of in the chorus there, would that rawness be too much still? So that's an interesting
Are we going to sell, Chevrolets afterwards too? I mean, this studio-driven effort. I mean, death as entertainment versus death as community or national dialogue. I mean, you walk that line. I know in your career, it's a tricky line to walk. And for me, watching those clips, it seems like there's so much we could criticize about both in terms of the mores of Marcus Welby and the saccharine condescension of the soundtrack in Grey's Anatomy. But Grey's Anatomy really touches me. That scene touches me because this is, as you mentioned, it's a surgeon who's on the ground with a patient, sort of encouraging him to take off his own mask and die in her arms, and modeling for the family how to be present with the patient while he's dying. I mean, look, I'll talk about it a little bit later, but I've had a lot of experience as a caregiver, and the people who work with patients who are dying, who work in palliative care and who work in hospice, are the most marginalized population in the medical hierarchy. I do a lot of work in the military and in prisons, but I've never seen a hierarchy as rigid as the medical hierarchy. And to see the palliative care and hospice professionals, their voices marginalized. To see that scene where there's someone who's in the medical profession, who's in a position of power, modeling and what's noble about being with a person when he's dying, I think that's really a powerful thing. It doesn't really matter to me that it's on Grey's Anatomy or a show.
Well, it's compelling because we make choices when we make these films and what we cut and how we edit. And so we saw a close-up of taking the mask off.
Right.
We saw a close-up of the doctor taking both of their hands. So we saw that, and that was emphasized, and that is a modeling approach that can be very powerful for people, which we'll discuss after the next series of clips. So I think as you watch the next series, think about pay attention to the modeling and what the subtle moments are in this next series, which is clips from the movie last year, The Beginners, where Christopher Plummer won the Oscar for Best Supporting Actor for this film.